Welcome to today's section on cytology, where we explore how to differentiate benign and malignant tumors at the cellular level. Understanding this distinction is crucial for accurate diagnosis and guiding treatment strategies. In cytology, tumors are classified into two main categories: benign, which are generally slow-growing and non-invasive, and malignant, which are aggressive, invasive, and have the potential to metastasis. This video will guide you through the key cytological features that help distinguish benign cells from the malignant cells. We will look at change in cell size, shape, nuclear features, mitotic activity, and architectural pattern. By the end of this section, you will be able to recognize the hallmarks of malignancy under the microscope and differentiate them from benign lesion with confidence. Let's dive in and explore the microscopic world of tumors through the lens of cytology. Let's start. Tumors are broadly classified into two major categories: benign and malignant. Cytology plays a crucial role in the preliminary evaluation of tumors by allowing rapid, minimally invasive assessment of cellular morphology. By understanding specific cytological criteria, we can differentiate benign from malignant lesions and guide further diagnostic and therapeutic decisions. What's a benign tumor? Benign tumors are typically slow growing and well differentiated. They do not invade surrounding tissues or metastasize. Cytologically, the cells of the benign tumors closely resemble the normal cells from which they originate. That's one of the features that we have to look into the cytology. In cytology, benign tumors usually show a uniform population of cells with a minimum anisocytosis and anisokaryosis. Anisocytosis means variation in the cell size. Anisokaryosis means variation in the nuclear size. So, in the case of benign tumors, there will be minimum anisocytosis and anisokaryosis. Means we can see a uniform cellular population as like this in the picture. And there will be lower nuclear to cytoplasmic ratio. And the nuclear membrane will be smooth and the chromatin is finely granular because it is not that much rapidly dividing. So the chromatin will be finely granular and there will be absent or inconspicuous nucleoli. Only in rapidly dividing cell only nucleoli will be visible and there will be lower mitotic activities. Means benign tumors are not that much rapidly dividing. That's why these all features are normal or little bit only variation. These benign tumors are showing. Next is malignant tumor. What's a malignant tumor? Malignant tumors are characterized by rapid growth. Because of the rapid growth, the cells will be poorly differentiated and it will be highly invasive into the surrounding tissues and it will invade the blood and it will metastasize to the distant organs. These aggressive biological behaviors are reflected in their cytological appearance. So it will show marked cellular atypia. Next is general criteria of malignancy. The cytological criteria of malignancy can be broadly grouped into cellular, nuclear, architectural, and mitotic abnormalities. Recognition of multiple criteria increases the confidence of a malignant diagnosis. First, we will discuss about the cellular criteria of malignancy. At the cellular level, the malignant cell shows marked variation in the size and shape. That means the malignant cells will be pleomorphic. There will be variation in the cell size and also in the shape. So, in the case of benign, what we saw was the cells will be uniform in shape and size. But in the case of malignancy, the cells will be pleomorphic. And there will be an increased nuclear to cytoplasmic ratio. It is because the cells are rapidly dividing, so the nucleus is not getting enough time to mature. So the nuclear size will be bigger. And there will be cytoplasmic basophilia. There will be increased blue color to the cytoplasm and there will be cytoplasmic vacuolation. We can see vacuoles on the tumor cells. Next is nuclear criteria of malignancy. Nuclear abnormalities are the most reliable indicators of malignancy in cytology. Malignant cells exhibit significant variation in the nuclear size and shape, and the chromatin will be coarse and clumped, and there will be irregular nuclear membranes, and the nucleoli will be multiple or prominent, often referred to as macronucleoli. So here in the picture you can see hyperchromasia means there will be increased color of the cells and also the nucleus. There will be nuclear enlargement we can see, irregular nuclear membrane we can see, and there will be multiple or very prominent nucleoli, and there will be increased nuclear cytoplasmic ratio, that is mainly due to lack of maturation of the nucleus, and there will be nuclear pleomorphism. Usually in the normal cells all the cells will have similar size and shape for the nucleus, but in the case of malignancy there will be pleomorphism. There is a variation in the size and shape of the nucleus. Next is some mitotic and architectural features. Actually, in the case of benign tumors, where it will have a very less mitotic activity and usually resemble the normal tissue. So there is not much change in the architecture. But in the case of malignant tumors, frequently show increased mitotic activities, including abnormal mitotic figures, loss of cell cohesion, and disorganized cellular arrangement. Usually in the case of benign tumors, the cellular arrangement will be similar to that of the normal tissue, but once it becomes malignant, it will lose the cell cohesion. Usually epithelial cells will stick each other, but once it become malignant, it started losing that attachment between cells. So, and there will be a disorganized cellular arrangement, and we can see a lot of necrotic material on the background, because based on the growth, that much blood supply won't be there in the malignant tumors. Because of that, we can see a lot of necrotic background material. In conclusion, cytology is a powerful screening tool in tumor diagnosis. A thorough understanding of the cytological criteria of malignancy allows accurate differentiation between benign and malignant tumors, enabling early intervention and better clinical outcome.